Hello, my name is Tony Mosier, and I am a marriage and family therapist. I have spent the last 30 years working exclusively with youth and their families in the United States. I'm a co-founder of TELOS, a group of mental health programs designed to help young people and their families who are dealing with major mental health crisis.
大家好，我叫 Tony， 我是一个婚姻跟家庭的治疗师。在过去的30年内，我非常努力的帮助美国的青少年跟他们的家庭，跟他们一起合作。我是 TELOS 的共同创办人，这是一个专门协助美国青少年和他们家庭心理健康治疗的单位。那我们的目的是要帮助年轻人从重大心理健康危机中疗愈，并且克服困难。那我今天非常荣幸能够受邀来台湾跟各位交流。
I'm so honored to have been invited to speak with you. I applaud your interest in and your commitment to youth mental health. I would like to thank the Taiwan Cognitive Enhancement Association for their generosity in sponsoring our visit to your beautiful country. I express gratitude to the Far Eastern Memorial Hospital, the Zhongdong Foundation, and the National Education Action Alliance. And I would like to recognize and thank Deputy Director Chen from the NHIA and other government dignitaries from New Taipei City.
那我今天很激赏大家对于青少年心理健康这么的关心，非常感谢台湾认知功能促进协会邀请我来这次台湾的访问，然后我也很感谢这次的主办单位，包含台湾认知功能促进协会、亚东医院以及国教行动联盟、财团法人董事基金会，然后也很感谢我们今天有这么多政府的长官来这边到场关心。
This is my first visit to Taiwan. It is so beautiful. The food is so good. If I lived here, I would weigh much more than I do because I would eat your seafood all the time. It is hard to imagine in such a beautiful country that there are any who struggle with anxiety and depression. But I know that mental illness is a global problem, and there is no part of the world that's untouched by it, including the United States. So I'd like to start with some general statistics about mental health in the United States.
那我这是第一次来台湾，我觉得台湾是一个非常美丽的地方。那特别是食物，要是住在这边的话，我应该很快就变胖，因为这边的海鲜非常的好吃。那很难想象这个地方的人也会有面临焦虑还有忧郁的困扰。不过其实我知道心理疾病是全球性的一个问题，没有一个地方可以完全避开这个问题，包含美国，包含台湾。那所以我今天的演讲一开始，我想分享一些美国的数据。
In the United States, we've seen a dramatic increase in the rise of young people on the autism spectrum disorder, which we call neurodiversity. The latest data from the Centers of Disease Control indicates that in 2020, 1 in 36 children were diagnosed with ASD, or neurodiversity. In 2016, it was 1 in 54, and in the year 2000, it was 1 in 150. So these numbers suggest a dramatic increase. Of course, we need to remember that we have improved our ability to detect and diagnose autism spectrum disorder or neurodiversity.
那举自闭症来说的话，它是神经多样性的一种。根据美国最新的数据，2020年每36个儿童就有一个是自闭症的光谱障 ISD。那相较之下，2016年是每54名才1名，2000年的时候是每150名才1名，所以这些数字显示出增长的趋势。不过我们也要考虑到，就是有可能检测的方法和标准的诊断的标准也有一些变化。
According to the National Institute of Mental Health, major depression affects approximately 8.4% of adults in the United States. That's 21 million people. Depression is more common in women than in men, and depression is highest among individuals ages 18 to 25, so young people. There's been an increased trend in the prevalence of depression over the past decade, mostly in adolescents and young adults.
根据美国的国家心理健康研究所的资料，重度忧郁症每年大概影响8.4%的美国成年人，大概是2100万这么多人。那女性忧郁症的比例是高于男性，而且这个18到25岁的年龄层，也就是所谓的年轻人，忧郁症的盛行率是最高的。那在过去10年，忧郁症的盛行率有上升的趋势，特别是在青少年还有年轻的成年人里面。
Anxiety disorders are the most common mental illness in the United States, affecting nearly 20% of the population. Anxiety disorders are also more common in women than men. They often begin in childhood and adolescence or early adulthood. General anxiety disorder, panic disorder, social anxiety disorder, and specific phobias are among the most common types of anxiety disorders.
那我们再来谈谈焦虑症。焦虑症是美国最常见的心理疾病，每年大概影响19%的人口，大概有4000万人。那焦虑症在女性的发病率也高于男性，通常在儿童、青少年或是成年的早期就会开始。那另外还有广泛性的焦虑症、恐慌症、社交焦虑症，还有特定的恐惧症，也是常见的焦虑症的类型。
The latest statistics on suicide in the United States provides a stark view of the public health issue. So in 2021, there were approximately 48,183 suicides in the United States, making it the 10th leading cause of death. After a steady increase of suicide from 1999 to 2018, there was a slight decline in 2019 and 2020, but the numbers began to rise again in 2021. Men die by suicide at a rate of approximately almost 4 times higher than women, with a rate of 22.8 per 100,000. The suicide rate for women is 6 per 100,000.
那美国的自杀问题也是一个很严峻的公共卫生问题。2021年，美国有高达48183个人自杀，那它已经成为美国第10大的死亡原因。从1999年到2018年，自杀率是不断的在上升。2019年和2020年有一些下降，但是到2021年又再次上升。那男性自杀的比率大概是女生的3.9倍，所以男生的自杀率每10万个人里面有22.8人，女性的自杀率大概是每10万人里面有6人。
Suicide is the second leading cause of death for young people ages 10 to 34. Among those aged 35 to 54, it is the fourth leading cause of death, and suicide rates are also higher among older adults, particularly those who are 85 or older.
那自杀也是10到34岁这个年龄段里面第2大的死亡原因，在35到54岁之间，自杀是第4大的死亡原因。那其实老人的自杀率也很高，特别是在85岁或是以上的群体当中，其实自杀率也是蛮高的。
In suicide in the United States, in comparison to suicide rates in Taiwan, our two nations are very similar in the prevalence of suicide rates. In Taiwan, I'm told it's 14 to 16 suicides per 100,000 people, which is the same as the United States. Also, more women attempt suicide and more men complete suicide. Also, suicide has been growing in young people, and it is also prevalent in older people. And I apologize for speaking of such unpleasant things, but we are here to talk about the brutal facts of this crisis that we're dealing with.
那在台湾的话，我有做一下功课，就是年轻人跟老人的自杀率也是蛮盛行的，女性的忧郁情形比男性严重，然后男性的自杀率比女性高。那我很抱歉，我的演讲一开始就讲那么沉重的话题，可是我们必须要去面对，因为这就是一个危机。
Again, this unpleasant information. The means of suicide in Taiwan is the most popular are hanging and poisoning, while in the United States, the most common are firearms or guns, particularly for men. Why is this? Well, if you've seen any American movies, you know that Americans seem to love their guns, and which is maybe good for movies, but not so good for mental health.
那在台湾的话，自杀的方式可能是上吊或是服毒，在美国的话就是举枪自尽。那原因是因为大家都可能知道，美国是一个喜欢拥枪自重的文化。那这个在电影里面应该常常看到，会让电影很精彩。可是，在现实生活中的话，就是另外一个烦恼了。
These statistics underscore the critical need for ongoing mental health support in both of our countries. We need prevention strategies. We need more public awareness to reduce the incidence of suicide across our countries and across the world.
那这些数据的话，说明了就是心理的卫生在美国、在台湾都是很重要的，所以我们需要很积极的去思考一些预防还有策略，让这些数据可以有效的下降，并且提升大家的意识。
For those here from the national government or from local government, for those here who are treating mental health issues, I congratulate you for your efforts to address this problem. In my opinion, there's no greater cause than the cause for mental health and the welfare of our citizens, especially our young people. And I know that I'm just honored to stand shoulder to shoulder with the mental health professionals who are here in the room, and I consider you my friend in healing.
那我很感谢今天有这么多中央还有地方政府的朋友出席，那也要再一次感谢你们对于这个议题的重视。其实心理健康的成本是很高昂的代价，所以我们要很重视这个议题。那今天我来这边是和大家肩并肩一起来面对这个议题。那我希望我们是像朋友一样并肩作战。
To address the mental health crisis in the United States, a continuum of care has been created over many decades. When young people in the U.S. first begin exhibiting mental health symptoms, they seek help from community professionals like therapists, psychologists, and psychiatrists. These professionals provide individual therapy, family therapy, group therapy, psychological testing, and medication management. And for most people, this is sufficient in the United States.
那为了解决这些心理健康危机，美国有建立了一个连续的照护体系。当美国的青少年首次出现心理健康症状的时候，他们通常第一步会是向社区的专业人士来寻求帮助，像是治疗师、心理学家或是精神科医生。那这些专业人士会提供个人疗法、家庭疗法、小组疗法、心理测试或是药物管理。那对许多家庭来说，这个层次的照护已经可以满足他们的需求。
Sometimes outpatient therapy is not enough, and we move to the second box, which is intensive outpatient therapy. These youth would enroll in an intensive outpatient program, or IOP, and this is a more structured treatment that provides therapy and support several times a week while allowing the youth to still live at home on the weekends and in the evenings.
那我们刚刚讲的是一般门诊的状况，可是有一些青少年他可能需要更为强力的介入，所以他们就会参加一个重症门诊，我们等一下简称为 IOP（Intensive Outpatient）。那这是一个结构化的治疗计划，每周提供多次的疗法和支持。那个体还是可以在家生活，比如说周末或是晚上，他们会回到家中生活。
If IOP is not enough, youth can then enroll in a partial hospitalization program, or PHP, which is more intense than an IOP. These programs provide treatment for several hours a day, several days a week, but they do not require overnight stays.
那如果 IOP 还不够的话，青少年可以参加 PHP， 就是部分住院模式，partial hospitalization pattern。那这种计划是比我们刚刚讲到的重症门诊还要更密集，它是提供每周数天、每天数小时的治疗，可是它不需要过夜住宿。
Some youth not responding to the intense interventions in partial hospitalization programs will be referred to a wilderness therapy program. These programs provide all the services of a PHP, but in an outdoor adventure setting. Youth will camp and hike with a group of experienced mental health trained guides. These programs aim to remove youth from their everyday environment and distractions and technology. They help these youth focus on personal growth and healing in a supportive and challenging natural environment. And I have met some professionals here who are working on bringing this intervention to Taiwan.
那我们刚刚讲到，就是有一些青少年他对 IOP 和 PHP 是没有什么作用的，那这时候就有另外一个选择叫做 Wilderness Therapy 荒野治疗。这个计划呢，它是提供跟 PHP 很相似的服务，可是是在户外的环境中进行。那在这样子荒野治疗当中，青少年会和经验很丰富、受过心理健康培训的导师一起露营，还有徒步旅行。那这个计划的目的呢，是要让参与者可以脱离日常他们环境的干扰，他们可以更专注的在个人成长，还有在支持性还有挑战性的自然环境中疗愈。那我很高兴听到今天在场其实有很多专业人士，试着要把这套体系引进到台湾来。
When youth get to this level of clinical need, the problems that they face have taken years to develop. And sometimes it cannot be resolved in a short period of time, in 5 to 7 days or even a few weeks. Sometimes these youth need to go on to what we call a residential treatment center, which is the fifth box we see up here. Youth in a residential treatment center are there with severe mental health crisis requiring intense monitoring and treatment. They're there for a long term in a structured live-in environment for individuals needing comprehensive treatment and support. My colleagues and I are specialists in designing, building, and operating long-term residential treatment centers where youth live and receive treatment from 3 to 12 months.
那我们刚刚提到一些服务，有一些青少年还是没有办法有很好的反应，那持续对于自己还有别人造成风险，所以那这些青少年的话，还有一个选择叫做住宿型治疗，我们简称为英文是 RTC。那他们会需要密集的监测还有治疗。那 RTC 呢，就是对于这些青少年提供综合的治疗，还有长期的支持和照护，并且是在一个结构化的居住环境中进行。那我的同事就是Tony 跟他的同事呢，就是专注在设计、建造还有营运这些 RTC 居住型的治疗中心，让青少年可以在这边接受为期3到12个月的治疗。
And finally, following a stay in an RTC, patients go on to receive aftercare services. When they go home, they receive comprehensive aftercare plan, and where local professionals then rally around that young person to help them maintain the progress that they made in residential treatment.
那在 RTC 治疗以后呢，青少年会带着一个综合的后续护理计划回到家庭。那当他们会运用到就是社区的或是当地的专业人士提供许多后续的支持。
Okay. In the United States, we have a privatized healthcare system. Some of these services I mentioned in this continuum are available with government funding, but they are typically only available to lower income families. Some of the government-funded programs are poorly funded and less effective than the privately funded programs.
那在美国的话，医疗体系是一个比较私有化的系统，所以虽然是有一些医疗项目是可以用公费去支出，可是通常是仅限于低收入户，所以这个照护体系有的时候会没有办法连续下去，会受到中断，就是因为经费的问题。
So in the United States, there are 3 ways of getting help for your child at this higher level of care. You can, 1, qualify for a government-funded program because you are a low-income family. 2, you can get funding for a higher quality private program through private healthcare insurance. Or 3, you can pay privately without the help of government funding or health insurance. This represents one of the problems with the mental health system in the United States. Not everyone can access the higher quality care like Telos because it is private pay and they simply can't afford it.
那在美国的话，就是你要支付你的医疗有3种方法。第一个是去公费，就是你要去申请这个资格，比如说证明是低收入户之类的。那第二个的话就是走私有的体系，比如说可能是保险的一些体系。第三个就是你不是公费，也不是保险支出，你要自己去抽钱。那这样子的话，就是说明了，就是在美国你是很难有时候取得就是高品质的这个医疗的照护，像 TLOS 这样的系统，因为我们几乎完全是必须要靠私人支出来支付这样的经费。
In the United States, we sometimes see people with undertreated mental health issues cycle through these lower levels of care several times. We say these people are in the revolving door of mental health treatment system. Sadly, many of them will continue in outpatient treatment, followed by an emergency short-term 3-day psychiatric hospitalization over and over and over again. We say in the States that this is the equivalent of putting a Band-Aid on the bleeding stump or a missing limb. What these people need is treatment that is more intensive and longer lasting.
所以在美国呢，我们常常会看到一些心理健康状况，其实他们还没有得到充分的治疗，可是他们会反复在低层次的照护中循环。那我们会有一个专有名词，叫做这些人他们是在心理健康治疗系统中的旋转门案例，因为就好像是他们从这个门出去，然后马上又旋转进来。那他们可能就会持续的先接受门诊治疗，然后呢，可能有状况以后就接受紧急的急诊、精神病住院，然后又恢复到门诊的体系，所以就很像是我们在美国有一句话，就是你好像在一个断掉的手上面贴小绷带、小 OK 绷是没有用的。其实这些人需要是更有强度、更持久的治疗。
So why are residential treatment centers so effective? It's because they provide a structured daily schedule that helps individuals establish regular routines and stability, which is critical for mental health recovery. It provides controlled environment, which limits the external stress and the distractions, allowing individuals to focus on their treatment. And it provides intensive therapeutic interventions like individual, group, family therapy, and other evidence-based practices.
那为什么住宿型治疗会有效？就是因为它是一个很结构化的环境，它可以控制许多的变因，然后针对个体复杂需求来全面的治疗。他们通常是24小时的监护还有支持，让患者可以很专注的在那个康复的过程。然后透过除了心理治疗，还有一些社交技能训练，那搭配就是其他的疗法，比如说团体疗法、家庭疗法等等，那就可以让患者有更好的疗程，还有之后的适应日常生活。
In the United States and maybe throughout the world, there is a saying, it takes a village to raise a child. Do you have that saying in Taiwan?
在美国，我们有个英文谚语是说，养大一个小孩需要全村庄的努力。我想知道中文有没有类似的表达方法 ？Yes, I think we do have.
Okay. In the lower levels of care, many professionals don't communicate with each other as they try to help the child. In a residential treatment center, each child has a multidisciplinary treatment team working together as a village to help the child benefit from treatment. Treatment often involves a team of professionals such as psychiatrists, psychologists, social workers, nurses, who all work together to address the various aspects of an individual's mental health needs. So, residents have access to support and supervision at all times from highly trained individuals.
那在比较低层次的护理体系里面，许多专业人士他们其实之间是没有有效的沟通，没有办法协同去帮助孩子。可是，在 RTC 里面，每个孩子通常会有一个跨学科的治疗团队，就像是一个村庄共同合作来帮助这个孩子。那治疗团队包含精神科医生、心理学家、社工或是护理师，大家会一起协同处理个体心理健康的各个方面。所以，这个居民他可以随时获得支持跟监督。那工作人员都是非常训练有素的。在危机情况下可以例行进入介入。
In many residential treatment centers in the United States, much of the therapy is experiential therapy. Because talk therapy, sitting and talking about your issues, is only so effective with young people. Young people much prefer to do rather than talk. So experiential therapy is where we get up and we get out and we do activities that help them process through the mental health issues that they're working on.
那在我们美国的这个住宿型的治疗，其实蛮多的治疗形态不是谈话性的，因为其实年轻人对于他们来说谈话性不是那么有效，他们比较喜欢就是坐而言不如起而行，所以我们会有比较多体验型的，就是设计一些活动，让青少年可以透过实际参与来进行这个疗程。
Research suggests that youth who can't be helped in any other way often respond very well to residential treatment. TELOS, our treatment program, has been collecting data on its effectiveness since 2006. With tens of thousands of data points, the treatment has proved to be very healing, and when measured from 1 year to 4 years post-treatment.
那研究表示呢，有一些青少年他们之前没办法透过其他方式获得帮助，可是呢，对于这个 RTC 就是住宿型的治疗是有良好的反应。那我们 TELOS 在2006年以来在收集我们疗效的数据，我们有数以万计的数据。那我们提供的治疗呢，促进了疗愈，而且甚至是在结束疗程以后1到4年内测试我们的受试者，他们仍然是保持有效的。
TELOS uses a standardized measure called the Youth Outcome Questionnaire. It measures the levels of mental health distress across many domains, including suicidality, mood dysregulation, family conflict, social functioning. A score above a 46 indicates that a child is in severe mental health distress and is in need of intensive treatment. A score below a 46 indicates a child is within the range of normal functioning. So higher scores indicate more distress, and lower scores indicate less distress.
好，那我们 TELOS 是用一种标准化的测量工具，叫做 Youth Outcome Questionnaire 青少年结果问卷。那这个问卷会评估很多领域的心理健康困扰，包含自杀的意念、情绪调节困难、家庭冲突，还有社交功能。那如果你得分46的话，超过46就表示你的小孩面临严重的心理健康困扰，需要很密集的护理。那得分如果低于46的话，表示孩子的功能是正常范围内，所以得分越高，表示他们的心理困扰越大。那我们入院到 TELOS 的孩子，平均得分是高达89分，表示这些小朋友他们都是这些年轻人，他们都是有蛮严重的心理健康困扰。
The average score of a child admitting to TELOS is 89, which indicates severe distress. That score taken again at discharge from the program is 30. The score taken 1 year following discharge is 38, which is well within the range of normal teenage functioning.
那我刚刚讲到入院到 TELOS 的孩子，平均分数是89，就表示他们是有严重的心理困扰。可是通常经过治疗以后出院的时候，我们再测他们的得分会下降到30。那即使出院后1年，这个分数还是可以维持在只有38左右，是完全是在正常青少年功能的范围里面的。
These types of outcomes have only been consistently achievable through the use of multidisciplinary treatment teams working together with a child in a residential treatment setting.
那这样良好结果的持续实现呢？我相信是通过多领域跨学科的治疗团队，在我们这个住宿型的环境中跟孩子合作才能够实现的。
At our program, we also measure whole family functioning using the Family Assessment Device, which is a standardized tool that assesses family communication, conflict resolution, and family satisfaction. As you can see, the results 1 year post-discharge are similar to those of the Youth Outcome Questionnaire. They're well within the normal functional range. So this data suggests that not only are patients getting better in long-term residential treatment centers, but entire families are as well.
那我们也有就是把家庭纳入那个量表的评量标准里面，也是一个工具。就是我们会在问卷里面设计，就是这个孩子他跟家人的沟通程度，还有他们家庭是如何来处理冲突，以及这个孩子对于家庭的满意度。所以通常经过治疗以后，我们再做评估的话，这些孩子他们对于这个家庭方面的这个分数，也都是可以达到正常的范围内。所以表示说，我们的疗程不只是帮助了孩子本身，其实是帮助了他和他整个家庭。
So I will share one patient's course of treatment. The photos I share in the next several slides are of real patients at Telos that have given us permission to share their images. You will see many photos of patients on therapeutic recreational activities, which is a large part of the healing process at our program. These activities help young people process through difficult mental health issues in ways that talk therapy simply can't.
那我接下来会分享一些患者的治疗过程，所以大家等一下看到的照片都是来自于我们真正 Telos 的患者。那我们在这边分享他们的照片是有先取得他们的许可。那等一下看到照片会发现，这些孩子其实他们很多是在从事活动，就像我刚刚讲的，他们透过从事这些活动来达到疗愈的效果。
So this is William. He struggled with major depression, trauma, suicidality, self-harm, substance use, school refusal, and a process addiction, which is a way of saying he had an addiction to overusing technology.
这张照片是 William， 他是那时候是15岁，他来到 Telos 的时候面对的问题是，他有重度忧郁症，然后创伤、自杀意念、自我自残，然后他会使用药物滥用、逃学，然后呢有科技成瘾症。
This is a photograph of one of our campuses. William came to our program from his home in China. His parents found our program through the use of an international educational consultant that their family had been working with. Most of the students at our program are from the United States, but about 5 to 10% are from other countries. These individuals come to us using an I-9 through SEVIS, which is the Student and Exchange Visitor Program.
那威廉刚刚介绍到，他是来自中国，这是我们其中 Telos 的一个校园的照片。那他会来到我们这边是透过中国的一个咨询机构介绍他来的。那我们 Telos 的住民大部分是美国人，但是有5%到10%是来自其他国家的。
As a young child, William had been the victim of sexual assault by an older friend. In middle school, he became introverted and withdrawn. At age 14, his parents learned that he had been engaging in self-harm, cutting his upper thighs in an effort to soothe feelings of anxiety and depression. They started seeing a local therapist, both individually and as a family, and William started taking medication to help with his mood.
那威廉小时候，他曾经受到一些年长朋友的性侵哦。那中学的时候，他就开始变得很内向、很孤僻。14岁的时候，他的爸妈发现他会在自残，他会去割他大腿的上半部。他说他自残的过程可以缓解他焦虑和忧郁的感觉，所以他的父母就开始带他去看当地的治疗师，那也让他开始服用药物来调节情绪。
In spite of these efforts, William continued to decline, and at age 15, he started using marijuana regularly, started drinking, and began experimenting with prescription pills. His parents were terrified because of the many fentanyl deaths in their community, and they were worried that William was one overdose away from death. So they tried to restrict William's time with his friends. He became verbally and physically aggressive with his parents.
那虽然他们有做出这些努力，威廉的这个病情还在恶化。15岁的时候，他开始会吸大麻和酗酒，而且开始会用一些处方药。那他的社区，他们住的那个社区，其实已经有一些年轻人因为吸毒过量而死亡，所以他爸妈很担心威廉也会距离死亡其实只有一步之遥，所以他们开始限制威廉跟他的那些吸毒的朋友一起鬼混。那威廉这样就很抗拒，他就对他的父母开始有一些言语跟身体上的攻击。
You remember the continuum of care that I showed a few slides ago. William's parents tried an intensive outpatient program and a partial hospitalization program, but after a few days or weeks of enrollment, he refused to go. He spent unusual amounts of time on his phone. his in-person friendships diminished until his only source of social contact was with a group of online friends involved in a popular gaming site. And in late summer, William had his first suicide attempt.
那他的爸妈就是帮他报名了，就是帮他让他带他去，就是我们刚刚讲的重症门诊啊，或是部分住院的模式。他有去了几周，可是后来就不去了。那他在吸毒的行为不断的升级，然后呢，在手机上也花越来越多的时间，那现实生活中的朋友越来越少。到最后，他唯一的朋友来源是一群跟他一起玩线上网站游戏的朋友。然后有一年的夏天 ，William 就第一次尝试自杀。
Fatigued and frightened and desperate, William's parents made the decision to enroll him at Telos in a residential treatment program. Because he was unwilling to go voluntarily, his parents hired a transport company that specialized in safely and humanely getting a youth to a treatment setting.
那后来就是William 的爸妈就决定让他来 Tilo 试试看。那因为William他不愿意自己来，所以他的爸妈还必须要聘了一个司机，专门强迫载他来，让他确定他可以安全的来到 Tilo 这样子。
Initially, William was unhappy at Telos. In his family therapy sessions, he raged against his parents, telling them that he had no need to be in treatment. He promised his parents he would attend therapy and engage in treatment at home. But his parents persisted, listening to his complaints and gently but firmly restating the request that he engage in the program.
那一开始 William 在 Telos 过得很不高兴，他在家庭治疗那边就对爸妈大发脾气，就是说我不需要来这边接受治疗，然后他还告诉爸妈说我们可不可以回家，在家中进行治疗，我会好好配合。但他的父母就是坚持下去，他温和坚定的跟 William 说，你就是必须要参加这个计划。
By the end of the first month, William had moved from anger toward his parents to a place of mental clarity. His medication was balanced on what the supervisory staff and therapists were reporting on a day-to-day basis. His therapist, in conjunction with the psychiatrists, psychologists, teachers, nurses, and supervisory staff, worked to teach William important coping skills. The team worked together the way members of an orchestra work together, each musician following the lead of a conductor.
那到了第一个月的结束的时候，威廉其实他对于父母的愤怒已经平息下来，他开始头脑变得清醒。那根据治疗师还有监督人员的报告，他的药物治疗已经恢复到平衡，不像之前会用非常多的药。那他的治疗师、精神科医生、心理学家、教师、护理师还有监督人员一起努力的向威廉传达一些重要的应对技巧。那这整个团队就像是管弦乐队的成员一起工作，每一个成员都恰如其分的听取指挥家的指挥来做好分内的事。
William started making friends. They were his first in real life friends in a long time. His sleep-wake cycle was balanced. He had been living on energy drinks and sugar, and now he had a healthy, balanced diet. He exercised every day. He attended his school, which was at the program, the treatment program. That school specialized in helping him learn in his individualized learning style. And he started to learn how to talk about family conflict without shutting down or escalating into arguments. William's parents learned how some of their reactions to his misbehavior were making the problem worse. They learned new ways of parenting and practiced them with him during visits to the program.
那威廉在 Telos 的计划里面交到了现实生活中的真实朋友，这是他沉迷游戏以后认识第一批现实生活中的朋友。那他的睡眠和清醒周期终于恢复到平衡。他在那之前都是会乱喝一些能量饮料，然后吃很多的糖来让自己保持清醒。现在开始学习健康均衡的饮食，他会每天运动，然后呢也会根据他的学习的需要来进行客制化的学习。那他也开始学习谈论家庭冲突，而不是每次遇到问题就开始把自己封闭起来，或是跟父母争吵。那威廉的父母也有成长，他们了解到之前其实他们对威廉一些行为其实会让问题变得更糟。他们学习新的教养方式，而且在来参观 Tilo 的时候跟 William 一起练习。
Over time, William had increasingly longer visits, including home visits, where he and his parents practiced their new skills.
所以到后来，威廉他有回家，然后呢，回到家里面跟家人一起进行一个为期5天的大家一起练习。
The therapist at Telos helped William and his family put together a team of professionals in his home community that would help him once he returned home from the program. We call this a home team.
那我们有一个专业的这个团队叫 Home Team， 就是帮助我们的这个学员，他们回到家里面以后，还可以怎么样做一些持续性的居家的这个后续的疗程。
Things weren't perfect after William left the program. At one point, he briefly relapsed on drugs. But the family had the skills to deal with the setbacks while not reverting to old ways of interacting that didn't work.
那所以我们刚刚讲到说，我们有专业人员为 William 跟他的父母提供持续的指导。那 William 后来就是从这个计划里面退出，因为他已经完成疗程了。当然事情不会永远是完美的，有一次他也是会有一些挫折或是重新退步的现象，但是呢不会退到像以前那样子糟糕的状况，那样子旧的互动方式已经结束了。
When we last checked, William was approaching high school graduation and had been accepted to the college of his choice. He was happy, stable, and thriving.
所以我们上一次和 William 接触，我们知道他的境况是他已经要从高中毕业，而且已经录取了就是他想要去的大学，他现在过得很好了。
Over the course of 20 years, I've seen thousands of patients like William go through the process of long-term residential treatment, and many lives have been saved, and many families have found the peace that they sought.
那20年来，我们见证了成千上万像 William 这样子的患者，他们经历了长期住院治疗的疗程，那许多的生命因此被拯救，那许多家庭找到了他们希望的和平。
I hope you enjoyed this presentation, and I admire your love for your children, and I salute your commitment and concern for the Taiwanese youth that are struggling with mental health issues. I'm happy to share the solutions that have worked for our youth in the United States, and I'm excited to learn from you as we strive together to create a world of healthy and happy families.
那我希望大家喜欢我今天的第一个演讲，我们很敬佩今天在座各位都是对孩子充满了爱。那你们对台湾青少年心理卫生的承诺还有关心，我要向你们致敬。那我很高兴今天在这边跟大家分享美国年轻人对他们有效的解决方案。那我也期待可以向你们学习，我们一起努力创造一个健康幸福的家庭世界。
Thank you.
谢谢大家。